Hi, and welcome back to Hill Ponton's VA Disability blog. We're going to continue our series today regarding Agent Orange. We're going to get an updated list on conditions that are considered presumptive. And we're also going to cover things that aren't usually mentioned, such as the registry, healthcare benefits, and benefits for your children. So we hope that you'll join us. Hi again, and welcome back to Hill Ponton's VA Disability blog. I am Natalia Jofre, the company COO.
And I'm attorney Rachel Cheek.
And we're going to continue our series regarding Agent Orange. And in our last blog, of Rachel, we covered a lot of things. Most importantly, I think, is blue water versus brown water versus boots on the ground. And you even covered a couple of groups that I had never heard about before that could also be covered with presumptive benefits due to Agent Orange exposure. I would like for you to reiterate those because I do feel that a lot of veterans that were erroneously previously denied or were given very low ratings are now going to either qualify for a higher rating or qualify for benefits that were previously denied, and they need to hear which group they fall under. So could you go over those five groups again?
Absolutely. So when I say Vietnam vets, this is covering the period between January 1962 and May 1975. So within those groups, you've got veterans who are boots on the ground, and those are vets who were, you see it a lot in the Marine Corps or Army. Physically, were present. They, you may have been stationed in Vietnam for a while. You could even have just been on if you set foot at all on the ground in Vietnam, even if it was just for, let's say a stopover for a couple hours or so, that would satisfy the boots on the ground category. Now, there's also what's called brown water Navy. And so those are veterans who served in the Navy and during this period for the Vietnam War, and they served in the inland waterways, so in the rivers and the deltas of Vietnam. And for a long time, only brown water veterans and boots on the ground veterans were entitled to the presumptions that we've been talking about. Well, in starting in 2019, the VA has now recognized that blue water veterans are also eligible for this presumptions. And so that's going to be veterans who served again in Vietnam during the 1962 to 1975 period and who were stationed on ships that were within the 12 nautical miles of the Vietnam coastline. So for that, you don't have to show that you ever stepped foot into Vietnam, but you do need to show only that you were stationed along the coastline. And the other two groups that we talked about that don't have to do with being in or around Vietnam at all are veterans who served on the Korean DMZ from September 1967 to August 1971. Agent Orange was used there to control the foliage and vegetation. And also Air Force veterans who didn't have to be anywhere near Asia, but can show that they worked on C-123 aircraft that were used to spray Agent Orange in Vietnam. So because how toxic this chemical is, it's very hard to break down. It lasts for a long time. So even veterans who never, encountered this stuff firsthand could be exposed to it based upon work that they did on this aircraft.
One other thing that I do feel merits restating is that you clarified for us that this does not just apply to Agent Orange; that it's all pesticides, correct? That were
Herbicides.
herbicides
Mhm.
that were used at the time within Vietnam and these five groups that were affected, and we referred to it as the world's worst rainbow, but basically Agent Blue, Agent Red, Agent Pink, Agent. I had heard of Agent Blue and Agent Red before,
Mhm.
but I didn't know that this is what they were talking about. So
Mhm.
I'm so happy that you clarified this because veterans need to know that if they were exposed to those herbicides, that they also still fall in this qualifying group.
Mhm.
Yeah. Um, so let's talk a little bit about uh, what conditions you told us about presumptive benefits, And so, if you could just give a brief description of what presumptive benefits are, and then what conditions are on that list for presumptive benefits.
Sure. So, what we've been talking about, these different groups that are entitled to the Agent Orange presumption, we keep saying. So, the presumption is if you're in one of those groups, so one of those groups that served in or around Vietnam, the Korean DMZ, or worked on C 123 aircraft, you are presumed to have been exposed to herbicides during your time doing any of those duties. So, what that means is if you later then come down with a condition that the VA has presumed to be caused by Agent Orange or herbicides. I'll say Agent Orange is a shorthand. That's the
Right.
most common one. That's what we use, but it really is kind of a catch-all for all these herbicides. Um, in any case, if you can show that you have one of these conditions that VA has recognized as caused by exposure to herbicides, you don't have to show anything else. All you have to do is show I served in or around Vietnam during this time, the DMZ, worked on the C-123 aircraft, and I have one of these conditions. That's all that's required for a finding of service connection under these regulations. So you oh, go ahead.
Well, it just made me think so if they make the automatic connection, is there a base percentage that you're going to get, or is the percentage based on the severity of the condition? It is.
Yes, it's based on the severity of the condition. Each condition is rated differently. VA's got hundreds and hundreds that of disabilities that they have to rate, and so each of these are under different guidelines.
Okay, great. And I know you want to give us the list of those presumptive conditions. So please take it away.
Sure. So, right now, these are the conditions the VA has listed as. If you've got a diagnosis for this, then you can show that you fit the groups, then automatically you should be granted service connection. This is not a complete list of conditions that are caused by exposure to herbicides. There's many more that haven't been recognized as presumptive that would require you, if you were going to get service connected, to show a nexus, which is
Hmm.
not required for these cases. So these conditions are AL amyloidosis, chronic B cell leukemia, type 2 diabetes, Hodgkin's disease, ischemic heart disease. Also under that falls under ischemic heart disease is coronary artery disease. So a lot of different heart conditions are covered in that.
Hmm.
Multiple myeloma, non-Hodgkin's lymphoma, Parkinson's disease, prostate cancer, respiratory cancers, and soft tissue sarcomas.
Okay.
But wait, there's more.
Oh,
So there are three other conditions that are listed as presumptive, but you have to show that these conditions occurred, that you started developing these within 1 year of your exposure. So, for example, for these other ones that I listed, so for Parkinson's disease, for example, if you can show that you were in Vietnam in 1972 and in 2014 you get diagnosed with Parkinson's disease, that's fine. You can still get
hmm,
service connected.
hmm.
For these three conditions I'm about to list, the presumption is not so easy if the conditions showed up later in life. It's not impossible to service connect, but you're not going to be entitled to the presumption. So
Okay.
those conditions are chloracne, which is a type of skin condition caused by exposure to these chemicals, early onset peripheral neuropathy,
Mm.
and I'm not going to say this properly, porphyria cutanea tarda, which is a blood disorder that makes your skin pretty photosensitive and very sensitive to sunlight.
Okay. Okay. Um, and you talked about peripheral neuropathy or
Mhm.
early onset of it. And that's interesting to me because I know that a lot of our veterans that have diabetes have peripheral neuropathy. So, if you have diabetes, though, that is a presumptive condition.
Diabetes, type 2 diabetes is a
Type 2
presumptive
diabetes.
condition. And
Hmm.
sometimes if you're already rated for that, you may also later then be as your symptoms develop, you may be able to get service connection for peripheral neuropathy, showing that it's related to the diabetes.
Hmm.
But I have come across several veterans who only have peripheral neuropathy. They don't have diabetes as well, and so that's where showing that Agent Orange causes that would come into play there.
Okay, great. So, talk to me about healthcare benefits. Are there any special assignments or qualifications that veterans have for healthcare benefits as a result of their Agent Orange exposure?
So you just have to show that you have service from these dates that we've been discussing, from January 1962 to May 1975.
Hmm. Okay, that's it.
Mhm.
And if you have that, then you're automatically going to get your health care,
If you have some
basically.
of these through the VA and if you have these conditions. Mhm.
Okay. I've heard about this Agent Orange registry. What is it? Why is it important? What basic function does it serve?
So the registry is used for the VA to conduct studies, basically, to kind of be able to follow veterans who were exposed to Agent Orange or these other herbicides, and it kind of it helps with research purposes and with statistics. It may help other veterans down the line as the VA gathers information about how what kind of health conditions and complications are caused down the line by with veterans who were exposed to these herbicides.
Okay, so that's basically the purpose it fulfills. Um,
Yes, it's not the same thing as filing a claim.
mhm.
This is unrelated to getting benefits. It's on the healthcare side, and it's helps for research purposes.
I would think, you say it helps with research purposes, and I'm sure that maybe they had something similar where after a while you say, wow, 300,000 people were exposed and 200,000 of them ended up with this condition. That's where presumption probably comes from, because
Hmm.
after a while they say clearly this is what caused it. So it seems as if though that registry could serve an important purpose, not only for vets today but for vets in the future, and other conditions that they could develop.
Absolutely, and showing again, like you just mentioned, there may be more. Well, I know there's many more conditions that can be affected by Agent Orange, but aren't on these lists. And one would hope that whoever is in control of the registry and reviewing this information would take that into consideration.
I know that we get a lot of calls from veterans concerned about their children. And obviously, a lot of these children are now grown adults, right?
Hmm.
But their children were born with birth defects or other conditions, and they think it's as a result of their Agent Orange exposure. And
Hmm.
so my question to you is, can those children qualify for benefits? And if so, what are the requirements? What parameters do they have to meet if they can even get anything?
Hmm. Good. That's a great question. So the presumptive, the provisions for child benefits for children or for health care benefits for the children of veterans who were exposed to herbicides, it's pretty narrow. So one of the categories that we would be looking at would be um, children of who were born with birth defects and whose mothers served in Vietnam.
Mm,
So as you can imagine, there weren't a lot of women who served in Vietnam. Don't want to say none, or they wouldn't have this provision. But
right.
that one's pretty hard to meet, and they don't. There's no specific birth defects listed. It's just any birth defects that are evident in children of women who served in Vietnam. They're presumed to have been exposed to herbicides.
Hmm.
We've been talking about that the whole time. So, another category of children of veterans who may be entitled to benefits are um, people who were born with spina bifida and who either parent served in Vietnam or Thailand during the Vietnam War period, or whose either parent served on the Korean DMZ during September 1967 to August 1971. So that gives you a little broader area of a broader base of people who may be eligible for this. So while you have to have the specific condition of spina bifida, it's not so limiting as only one parent. They're not only looking at one parent.
Right.
Either parent could have served in multiple locations, so Vietnam, Thailand, or the Korean DMZ.
That's really important. I had never heard that before.
Hmm.
And I think that most feel, well, like you said, you have some moms, obviously back then, not as many women served in Vietnam, or were in the military service as there are today.
Hmm.
But it seems like such a narrow, uh, group to be in to potentially qualify for benefits. But then when you're talking about, it could have been the mom or the dad
Mhm.
that were in the military service, and the child had spina bifida, and then you said was it either in Vietnam, Thailand, or the Korean DMZ?
That's right.
Okay, and so if they, one plus one equals
Mhm.
presumption. Is that
Mhm.
accurate? Okay.
Well, it's not a presumption as far as like we're talking as far as benefits, but um, for VA benefits, but it does qualify them to be eligible for support from the VA.
Okay. Okay. Great. Any other benefits like that for any other children of veterans that you know of, or are those the primaries?
Those are the primaries, but I'm sure that there are deep within the VA regulations. There's some more that we could probably do a video about sometime.
Okay. Sounds good. All right. Well, this was really helpful, Rachel. Thank you.
Absolutely.
Thank you for joining us. We hope you'll do so again. But in the meantime, if you have any questions or concerns, please feel free to visit our website or call our office.